EHRs, emergency health records, or EMRs, emergency medical records. So to begin, some organizations that do utilize EMRs or EHRs would be the Carl Foundation Hospital, the Decatur Memorial Hospital, OSF St. Francis, the commonly known one around us here in Peoria, Paris Community Hospital, as well as Advocate Healthcare. These are just some examples. Of course, there are probably many more. So on the Carl Foundation Hospital's main website, they give a general description as to, or a general description of a questionnaire explaining will the patient records be available to Carl Foundations. It claims that the medical records themselves will be available for your specific or your own physician. It's their intent that the medical centers as well as Eureka Hospital will transition to the EPIC, which is another electronic medical record system to give all of the providers among Carl Hospital access to any sort of patient information as long as it pertains to their patients themselves. So they wouldn't outsource it or anything like that. As for Decatur Memorial Hospital, they explain how the chart information or the MyChart, which is their form of medical record, comes directly from the EMS record at the doctor's office. So all your specific EMS records will not be leaked per se or given out to anybody besides your doctor specifically or your doctor directly. So no other sources would be accessed in terms of that. As for OSF, so how OSF does their EMSs is that they have an order screen to place, excuse me, cut this right here, cut this right here, cut this right here. Okay. Okay, we're cutting back in. So OSF does the same exact process except among their laboratory records or among their laboratory sources, they have a sheet that you're able to fill out or that one is able to fill out in order to retrieve EMS information or EHR information from any sort of results laboratory or any sort of physician or hospital that is within their care, and then they're able to directly send it to whoever you need it to. As we look at Paris Community Hospital, they have an entire webpage directed to explain their implementation of electronic health records. So they explained how their transition to EHRs is essential for this new record system, and this time, in this case, they will be implemented soon or within the month of, or within the current month, excuse me. They've been working towards implementing it for a while, and the entire organization, in order to assure that all their patients' medical history is guaranteed to be safe, they decided to switch over to this format entirely. As we look at Advocate Healthcare, they also have an entire section for their EMRs. They're claiming that it provides instant access to the patient information, but it's only, of course, available by doctors, physicians that are for that person. It wouldn't be any sort of outsourcing or any sort of third party accessing it.
So the advantages to EHRs are what we're going to talk about next. The first one is ease of billing, and the explanation for that is integrating EHRs into the medical billing system has cut the billing work in half. The work time saved covers areas like data entry, applications used to process, and the transference of patient billing information across the internal systems. The second advantage is the doctor-patient remote communication. So EHRs can help doctors who are providing virtual care in the form of medical chats where patients ask questions about their medical incidents or conditions. This provides instant answers for patients and instant access to patient information, which allows patients to feel cared for properly. So if they're not able to go into the doctor's office, they can still see their doctor. The third advantage is that EHRs are customizable depending on which application you use on them. They're able to be programmed for specific departments or medical focuses, meaning they can all be tweaked differently for the benefit of the specific department, and it creates a more unique experience for the clinicians when searching through relevant visit reasons, medical conditions, and diagnoses. The fourth advantage we have is EHRs are accurate and clear. It helps eliminate the long-standing joke about the doctor's handwriting and how you can't really read it. And the EHR makes it so that it's very just clear on the paper, and it helps the patient read it a lot easier so they know what exactly they need and what they need to do, what prescriptions they need to order and pick up. And it allows the clinicians to understand each other as well as the patients to understand what they're experiencing and how they can get better. More advantages are the improved communication between the internal departments of the healthcare system. So instead of having people run around to different departments looking for patients or having to ask around about them, the EHRs provide rapid and direct communication between doctors and nurses, which provides better workflow between the departments. And for example, between the emergency room and the MRI team, they'll be able to use the EHRs for the fastest and most accurate results in order to provide the best care possible. Another advantage is the efficiency. And the scribe model is where the doctors and nurses have mobile tablets or workstations that link to the EHR system. So they have real-time data entry with the patients, and they can communicate with each other in real time so that it just helps everything kind of run better and increases the efficiency of the whole operation. And the last advantage is that it increases the amount of data collected and it can analyze it. So it allows for digital tracking of how the doctors are performing in their positions and in like certain individual situations. And the monitoring allows for a massive collection of data to analyze and create more efficient solutions to areas of the hospital where numbers seem like they're not to the standard that they need to be. Some of the drawbacks are the doctor-patient relationship during the visit. Some of the doctors in hospitals and healthcare facilities feel like it's not like they're actually doctoring the patient when it's through the screen because they can't be there one-on-one in the room to do the care that they want to. And while you can still have good conversations, they can't always completely help you, like besides answering your questions and telling you what you can do. Another drawback is burnout, and it comes from a lack of the person-to-person interaction between patients and doctors. It can be correlated to spending long time filling out EHRs and doing computer work versus patient care. It can also come from doctors feeling no sense of accomplishment from their jobs since they see less patients and more computer databases. The third drawback is that it's inefficient. The workstation requires multiple shared computers in a department for data entry and patient lookup. Usually there's more staff than computers available, which can cause some slowness in information processing and extended time away from a particular patient because they're waiting for computer access. Another drawback is that it's susceptible to data breaches from hackers. Because they're electronic, it's very possible for these attackers to get into the machines and be able to see the information that the doctors put in about the patients. And even with them adding security blocks, there's still opportunities for good hackers to find the loopholes in the security system and manipulate the data. The fifth drawback is that they're not very user-friendly in some of the programs. It definitely gives the doctors a good place to enter in all their information, but if they lack good formats and programs, then it can be very confusing and it would take a lot of effort and clicks to just get around the software and find what you're looking for. Then we have frequent adaptation to updates. Since there's frequent software updates, it can be hard for people who are especially slower with technology to learn how to keep up with the updates, depending on how major the changes are when it updates. And from a surveyed doctor group coming out of Ohio State, they said that even changes in color and where the buttons are would surprisingly disrupt the workflow and effectiveness of the EHRs because some of the doctors can't keep up as fast as others. And the final drawback is the cost. The initial implementation can run anywhere from tens of thousands of dollars to $1 million. And even after it's implemented, the updates and upkeep of the systems also cost a pretty penny depending on the systems and staff used.
Are EHRs or EMRs widely used in general? The answer is yes. In America, there's about a 94% usage rate by hospital-based physicians and 86% usage by office-based physicians. A big push for this was the 2009 Health Information Technology for Economic and Political Health Act. And especially during this coronavirus pandemic, EHRs are even more imperative to conducting patient interactions to prevent the spread of COVID-19 and as well as to notify patients of their test results as soon as possible. Are EHRs and EMRs widely used in the greater Peoria area? From my research, I found it more difficult to find a hospital that was not using EMRs. There are a lot of large hospital chains in the central Illinois area, making it really difficult to select individual hospitals for this research. Some of these chains include the Carle Foundational Hospital and OSF, of which I only selected one of each of the locations to allow a more diverse pool of hospitals to examine. Have you ever filled out a digital patient information form or other medical records via computer? Yes, in early August, I actually had a trip to the emergency room, and due to COVID, the trip itself was no contact for paperwork. The digital information input came after the fact when I filled out my patient portal to confirm medications to get my COVID-19 test results back. It was simple and convenient, and it didn't need completion right away. And that really gave me as a patient time to recover after returning home without having to worry about paperwork immediately. My experience with EHRs and EMRs, as I said, using the patient portal was really simple and easy, and I really understood what I needed to fill out. The test information was easy to understand and pursue further if necessary. The patient portal allowed me to monitor my medication and request refills for pickup. And overall, I really think that using EMRs through the patient portal as a way to contact doctors and understand your condition and understand everything for your medical history was amazing. And I'm really grateful for the ability to be able to have healed after my trip to the ER before I had to really focus on paperwork. I let the EMRs kind of take the lead for that. Are you concerned about your medical history being stored on a computer? I take cybersecurity courses at Bradley, and from taking even just a single class, I don't trust anything online or electronic, especially with something as vulnerable as a record, like a medical record. When hackers or malicious groups target something like a hospital, the records are one of the most valuable pieces of information to steal, corrupt, or manipulate. And while I have high expectations of security measures taken by hospitals, I won't completely trust their place on the networked computer. Do you think the risk of a privacy breach is higher with EHRs as compared to records contained in conventional paper file folders? I believe being able to access electronic records from almost any computer in the world after the right spyware is applied is an enormous risk. Paper copies of records can have their own risks, such as fire and people using smartphones to take photos of records. I do believe the accessibility of EMRs make them a higher risk than paper copies, and even if there was a hybrid option like paper copy with an offline hard drive copies, the upkeep will be remarkably difficult comparatively. And in a way, the risk is worth the reward with the convenience of EMRs.